Hello and welcome. This the first lesson Emergent issues in interoperability. In this video, the various barriers to interoperability are discussed in depth. Let's get started. Barriers to interoperability. Most healthcare providers agree that interoperability is necessary to improve data quality, which is a promising start. There is a significant gap, however, between what providers must do and how successful they are at doing it. That is because they have to overcome a plethora of interoperability challenges along the way. Looking at the barriers from the perspective of how serious they are, it is possible to distinguish primary and secondary barriers. The first of these is tied to standards. While other barriers which are relevant, but not seen as so serious at the current stage of market development in terms of their importance, are classified as secondary barriers. Primary barriers. The following are some of the primary challenges exist in the healthcare industry. 1. An avalanche of standards. Interoperability is a team effort, and standards should help achieve it in a well-coordinated manner. But seriously, how can you ensure that your clinic follows the same practices as other healthcare facilities when every standard is so different? The unfortunate truth is that what is supposed to be streamlining processes is actually thwarting them. As we've already seen, message formats, FHIR, and EHR interoperability standards are hard to adopt because they establish different information exchange rules. This results in a disjointed implementation process for clinics. 2. Access and 2. Use of data. Organizations cannot access the data they need or would like, and they face strict, contractual, limitations when wanting to use data. 3. Data liability. Existing liability laws are based on the concept of tangible products. Organizations cannot be sure whether they can have recourse to this legislation for data-based products, so prefer to fall back on contractual liability on a case-by-case basis. 4. Data interoperability. Different standards and specifications are used for the same data and for different datasets. 5. Too much data to handle. When health data flows from one system to another, it's important to prevent it from overflowing. This is not an easy thing to do. Interoperability in healthcare is about finding a way to deal with EHR/EMR information, data from IoT sources, internal hospital systems, and so much more. If you fail to handle them at the same time, they can disrupt your processes. To avoid this, you need to invest in data integration tools and healthcare analytics solutions. 6. Murky data exchange practices. Some providers use the interoperability trend to line their pockets. They impose fees that you have to cover to access health data, such as patients' EHR. This practice is called information blocking, and it's certainly a formidable obstacle to interoperability in healthcare. Insurance companies that refuse to share health data with providers present another hurdle. In a perfect world, you would be able to learn everything you want to know about your patient's previous treatments by looking into their claims. But this is not always possible because insurers are reluctant to grant access to them. 7. Organizational resistance to sharing data. Certain actors in the healthcare industry have a vested interest in not sharing data with other providers. For example, hospital systems compete for patients with urgent care clinics. When a request for patient data comes from an urgent care clinic to a hospital's EHR system, the motivation to share the data is slim at best. 8. Lack of skills and resources. Once again, interoperability only works if all clinicians, insurers, and government agencies join forces. But the thing is that many medical settings lack the financial resources to make the necessary changes. Interoperability requires initial investments that are beyond the budgets of many clinics, even though it allows for huge savings down the line. Lack of training also hinders smooth interoperability. Stakeholders need to invest in upskilling their staff at all levels to streamline workflows and ensure that everyone knows how to use interoperable systems, and this takes time. Secondary barriers. These are barriers which are relevant, but not seen as so serious at the current stage of market development in terms of their importance. Examples of such barriers include: 1. Data ownership. The concept of data ownership is far less controversial for companies than thought when the study was launched. Access to and use of data are much more important. 2. Data portability. This is not a bar to organizations sharing, accessing, and reusing data, except in very particular cases. 3. Intellectual property rights, IPR. There is not felt to be a need to have recourse to the exclusive protection conferred by IPR when sharing, accessing, and reusing data, as this tool seems inadequate in most cases. 4. Valuing data. The cost of data is an obstacle for data users, but if an organization is interested in sharing data, it will find a means of valuing it. This concludes the lesson on barriers in interoperability. Thank you for taking the time to watch.